Thanks, Joe. Welcome, everyone. We are here for the fourth tabling of the post-traumatic stress disorder bill for frontline workers. And I'm delighted to have with me, both in the audience and those up here, some true activists around this issue. First of all, on the panel, we have David McFadden, who's president of the Police Association of Ontario, Vince Savoya, representative of the Ontario Paramedic Association, and Jim Holmes, vice president of Ontario Professional Firefighters Association. We also have some members in the audience that I think I need to recognize, and that's Paul DeSimone, Chief Administrative Officer of the Police Association of Ontario, Emily Visser, spokesperson for OPSU's paramedics, and the woman who started it all, Shannon Bertrand, a paramedic who walked into my office many years back and told me about the struggles that she had had and others like her, and was brave enough to come forward, and truly I dedicate this bill to her. What does the bill do? In a nutshell, what it does is provide for presumed diagnosis for those with post-traumatic stress disorder when applying for WSIB claims. Now, right now, there's a circuitous route to go through. It's difficult to get. And remember, these are folk who are suffering from PTSD. And the last thing we want, I think, for our frontline workers, those who run into danger and not away from it, is to not be there for them when they need coverage and when they need our assistance. Certainly other provinces have done it. Just heard that BC, Manitoba, and Alberta all have this in place. And in fact, we have the model for this in place with our presumed diagnosis for certain forms of cancer for our firefighters. That originally was a New Democratic Party bill, picked up and made into law by the government. We want the same here. Truly, I talked to the Minister of Labour many, many months ago. They've, of course, been aware of this bill for many years, and asked if they would please act and move on this bill. That is the most direct way of providing this coverage for those who need it most. Just here in Queen's Park, yesterday there was a ceremony for fallen officers. And he will remain nameless, but certainly a much admired and esteemed police officer in my own riding said, wouldn't it be absolutely just and fit for those who die of suicide because of PTSD to also be remembered? Andre Morin in 2012 tabled a study on this, in which he slammed the current state of affairs, asked and called upon the government to work and to act. We're still waiting. So my hope is that we don't have to wait another year, but that once this bill is tabled, this government, Yasir Naqvi and the Ministry of Labour and Kathleen Wynne, the Premier, will act to make it law so that those, again, of our heroes, and they are heroes, can be recognized and given their due. So that's enough about this. I'm waiting to hear from our esteemed guests here. Vince, you're sitting next to me. Why don't you go first?
Well, thank you. Thank you for the invitation. And on behalf of the Ontario Paramedic Association and its 1,400 members from across the province, we're happy to be here. A special thank you to Shannon Bertrand. I know she's been working on this very, very long. We are in support of the bill. As Cheri mentioned, the rates of PTSD within emergency services, there's been a lot of research done, and we're looking right now at anywhere between 16 to 24% of our emergency personnel, be it police, fire, or EMS, being diagnosed with post-traumatic stress after attending a critical incident. And when we look at the rates of suicide, the 2009 statistics from StatsCan indicate that the highest rate of suicide occurs between men between the ages of 40 and 59, and the rate per 100,000 is 17.9, which means we're looking at 17,900 individuals committing suicide on an annual basis. And many of them, unfortunately, are first responders, whom we really don't hear too much about. So I applaud the bill. I really do think it's long overdue. And if there's anything that the Ontario Paramedic Association can do to assist you, we're here to help.
Thank you, Vince. And Jim Holmes.
I'd like to begin by conveying thanks, the thanks of all firefighters in Ontario to Ms. DiNovo for bringing this important piece of legislation forward once again. We truly appreciate her persistency and dedication. I've had the good fortune to be invited to sit on the Post-Traumatic Stress Disorder Roundtable that was formed by the Minister of Labour, Linda Jeffrey, some months ago. I have met to discuss the issue of PTSD with representatives from the Ontario Association of Fire Chiefs, the OPP, Police Association of Ontario, the Paramedic Association of Ontario, and others who came together with a common goal. That goal is arriving at ideas and solutions of how to identify and treat those that suffer from post-traumatic stress disorder and remove the barriers to receiving the care they need. We also need to train workers how to self-recognize the symptoms of PTSD. It's clear the issue of PTSD crosses both political, labor, and management lines. I believe Ms. DiNovo's bill will greatly assist those that have been identified as suffering from PTSD due to exposures in the workplace. Quick evaluation, diagnosis, and treatment are the keys to alleviating the effects of PTSD. This is no longer a make-believe disease. It is real, and it is affecting emergency workers everywhere. We have all been exposed to some tragic and horrendous events in our various professions. Most people suffer in silence, mostly unaware of the effect that the fallout from these events have on them, their friends, their families, and their co-workers. Making PTSD an illness presumed under the Workplace Safety and Insurance Act to be caused by a workplace environment exposure will assist in earlier treatment and a faster return to duty. This benefits all of us. Thanks.
Thank you so much, Jim. And finally, David.
Ms. DiNovo, thank you very much on behalf of the 34,000 frontline police personnel that I represent through 55 associations across the province. There's a quote attributed to an anonymous police officer used when the Ombudsman released his report on PTSD amongst OPP officers. Quote, "Imagine the most horrific things that happen in this city and no one really hears or sees. Murders, rapes, car accidents, violent assaults. This kind of stuff we deal with on a daily basis. Some of these cases involve children and teenagers. Post-traumatic stress disorder is an emotional and psychological response to experiencing life-threatening, disturbing, and stressful events. It can occur as a single traumatic event or through years of exposure to a series of events that build on each other, often subconsciously. The symptoms include, but are not limited to, nightmares, paranoia, rage, flashbacks, and panic attacks, and left untreated can lead to suicide. PTSD can manifest in an unrelated event or circumstance that, on occasion, has brought unwarranted criticism from police employers. PTSD is not a new phenomenon to occupations with an inherent risk of exposure to traumatic events. It's something that we just started to acknowledge amongst police personnel and the other first responders. Yet there are still many who refuse to acknowledge this disability and who will label those who suffer from as malingerers or fraud. This has to stop. The attitude has and is preventing some from reaching out to get the help they need when they need help. And treatment and the speed of treatment are essential to restoring well-being and productivity. The sooner the treatment begins, the better the outcomes are for the patients, their families, and the community at large, as well as their well-being and productivity is being restored. Right now, the WSIB rejects a significant number of claims submitted by police personnel who have been diagnosed with PTSD. The successful appeals of these decisions take years during which the symptoms of PTSD worsen. Access to necessary health care is not readily available. Sometimes there is no income. In order to prove that disability was caused by the job, detailed testimony must be given at tribunal hearings, reconstructing the horrific events that led to the illness. Reliving the horror without appropriate recoveries in place leads to setbacks in that recovery. The Police Association of Ontario is fully committed to getting our members the treatment they need as soon as possible so they can make a full recovery. Presumptive coverage is a key part of that process. Presumptive coverage means that once a member has been diagnosed with PTSD, it will be presumed that the illness was caused by the job unless the employer proves otherwise. This will allow our members to get the treatment they need as soon as possible. This does mean that suffering will ease, lives will be saved, and our communities will be better served. And yes, there will also be a cost saving as a burden on the healthcare system and other supports will be eased, and the productivity of the well individual will be back to work more quickly. Presumptive coverage is not a new concept. It applies to firefighters in Ontario who developed 8 types of cancer or have had a heart attack within 24 hours of battling a fire. The province of Alberta has recently introduced just what we are requesting, presumptive coverage for first responders suffering from PTSD. We ask that Ontario follow the lead set by Alberta and recommend that the upcoming budget include legislation that would help our members by providing presumptive legislation for PTSD and police personnel. Giving our members quick access to treatment and secure income is the most effective method of getting an injured worker back to work. It's also the most humane. Ms. DiNovo has been working with the PAO to develop the framework for legislation for several years. The PAO has gained the support of all political parties to bring this necessary piece of legislation into effect. The PAO calls on all parties to commit their support behind the introduction of this bill. The PAO thanks Ms. DiNovo for her commitment and her perseverance and appreciates her understanding and the value that she has placed in emergency frontline workers like the 34,000 members of the Police Association of Ontario. Thank you.
Thanks, David. So just a couple of things just to wrap up. When I did have discussions with the Ministry of Labour about this, with the new Minister of Labour, Yasser Naqvi, since February, he responded by talking about the roundtable that's ongoing. And I want to say the roundtable, wonderful though it is in terms of looking at the issue and destigmatizing, is not legislation. What we really need here is legislation, because no matter how much awareness is raised around this issue, at the end of the day, if somebody comes down with PTSD, they have to go to the WSIB and make a claim, and this will help them do that. So I wanted to say that first and foremost. So we want to see the roundtable as an adjunct to work in the legislation and to changes in the law, not as a substitute. And number two, people have asked me about, well, can't you screen more carefully for people who might get PTSD? And the answer to that is no, no more than you can for certain kinds of cancer for firefighters. The reality is we never know who's going to succumb to cancer or to PTSD until they actually get it. Our response should be, as caring citizens who ask these folk on our behalf to go into dangerous situations, to look after them when they do come down with it. So I'm going to leave it at that. Again, it's going to be tabled tomorrow, this bill in the House again, for the fourth time. But the most direct route is for the government to actually act and bring in their own legislation. That's what we're asking for. We've missed the budget. You heard David talk about the budget, a little too late for that, but it's never too late to do the right thing for our frontline workers. Thank you. Any questions?
So you did mention that this has been tabled for the fourth time, effectively tomorrow. Can you tell me how far it has made it through the legislative process previously when you introduced it?
It hasn't, because last time it was the government prorogued. The time before, I just didn't have the private member slot for it. Quite frankly, most members get one private member slot to second debate a bill, and I usually use that as a pragmatist for when I think I can get through. So each year I've managed to get something through, but the indications to the Minister of Labour was this was not going to be it. So this hopefully will be the year for this bill, but again, I can't emphasize enough, if I debate it, my next debating spot is in 2014. It's a minority government. I don't want to have this bill fall prey again to the machinations of the electoral process. I would actually like to see it come into place for our workers, and the most direct way that can happen, just like with the firefighters and presumed diagnosis for cancers, is the government does it themselves.
And you mentioned the roundtable that Yasser
Yes.
Naqvi was referring to, but you also mentioned that this is ongoing. Is there any idea of when that process might wrap up, and what might come from that in terms of a report or recommendations on legislation?
Well, so the gentlemen here are sitting on that roundtable, so perhaps direct it to them.
What has your experience so far been on that roundtable? How responsive has the government been to your claims?
Well, actually, it's at this point in time, it's not the putting forward to the government. It's the actual Ministry of Labour that are doing the roundtable, and both Jim and I sit on there for our respective organizations. At this point in time, we have all the pretty well all the representatives from the broader public sector unions that sit there, and basically what it is